Hey everybody. Thank you all for coming to this today. My name is John Doyle. I'm the director of the public affairs team here at Jacobi. It's not all over yet. We did want to open this up for a Q&A with you guys, with some of the people who created the film and some of the people you saw in the film. So I'm going to introduce a few people. We're going to have them all come up on the dais. If you would like to ask a question, just raise your hand. We're going to do this for about 30 minutes, and we'll pass the mic to you to ask your question. But just raise your hand, okay? First up, we're going to have Director of GSW, Jody Schiliro, who's here with us today. Let's give her a round of applause. Thank you, Jody. Jenniphyr Goodman, who's the producer of GSW, is also going to join us on the stage. Dr. Sheldon Teperman, who is widely featured, who's our trauma director at Jacobi, also on the stage. Dr. Romo, who was also featured, is medical director at SUV. Carjah Dawkins Hamilton, the program director of SUV. And last but certainly not least, Pastor Jacobi, who is our pastoral outreach director. Okay. If everyone just wants to have a seat up here, and we're going to open this up to everybody. So just raise your hand, and we'll come around.
Just before we do that, Jody had a good suggestion. We wanted to get an update from Jay and from Dr. Romo about the how the SUV program is doing. Because you guys have expanded and you've done amazing things. I think that's a good place to start.
First of all, give yourselves a hand clap here tonight. I do want to acknowledge, Doc, before I start, my church members that are here. Tonight was actually movie night at our church, but they took off to come here. Let's give them a hand. I'm going to ask them, would they stand? Since our inception, we have seen a decrease in our communities, in the shooting victims and shooting incidents. I'm grateful tonight to be a part of this program. One of the things that touched me tonight was when I see Dr. Teperman and Dr. Romo, how they talk to the parents and let them know that their child is dead. I'm the last one that have to sit and talk with parents at funerals right before they have to bury their child. One of the most painful experiences is to witness a mother and a father laying their child to rest. So this is very important to me. I'm very passionate about that. But we're grateful that our SUV team, and I'm going to ask our SUV team that's here tonight, would y'all just please give them a hand clap? Stand up, please. Because these are the young men and women with boots on the ground that make it happen. They're the ones that get out there in the street to let the young men and women that carry the guns to put the guns down, that there's a better way. And so I'm so godly proud of them tonight and of this program that we have saved lives. And statistics, NYPD statistics won't show the lives that we have saved from this program. So I'm grateful tonight.
Thank you, Pastor. I think we were asked about how the program has expanded, and I'll pass it over to Carjah as well to expand a little more. But we've been in existence now for 11 years. We've come a long way, Pastor. I think you can agree. When we started, it was me, you, social worker Erica, and about 4 outreach workers and 1 supervisor. And since then, we've expanded significantly. Our budget has increased significantly. Our staff, we're at over 50 now, Carjah? More than over 50, 60?
Almost 40.
Oh, 40, over 40. But, we've expanded to other sites, other outreach workers, supervisors, and I think the biggest thing is that we sit under the Department of Social Workers. Marnie's here? Marnie's here.
Yeah.
Marnie is head of social work, and also part of our leadership team, and has been critical in the expansion of our program and expanding our network of social workers, outreach workers, mental health providers, and really providing a blueprint for how programs like this can truly expand. And I think this is truly a model of an interdisciplinary approach, right? I think for those of us that work in healthcare or any field, you know how difficult it is to get multiple departments and multiple divisions within a hospital to agree on something. And here at Jacobi, we all agreed that we weren't going to stand anymore to watch our young people here in the Bronx be disproportionately affected by gun violence. And we have been successful, as Pastor Goodman mentioned. We continue to decrease the rate of shootings in our area. We continue to improve the rates of re-injury of patients that we see. We do publish in the medical literature of our public health model to provide some legitimacy to the program. But it's hard to, label us a complete success when people are still dying and individuals are still getting injured in our communities, disproportionately so. So we still have a lot of work to do. I think the film did a good job at capturing the impact of gun violence, but I think there's also a lot of good, positive stories. I know there's a lot of things that happen that we regret, but there's also a lot of patients that we save, a lot of patients that we do good for, a lot of participants that have done very, very well, who have gone on to finish school and get good jobs. A lot of our outreach workers have moved on within our state program to get better jobs, and these are all the outcomes that we're not able to measure. We're not able to measure the amount of shootings that are prevented. That's an immeasurable number, no matter how much analysis you make. But I think the biggest accomplishment are the people in this room, our outreach workers, who are out there really changing the norm in their communities and have taken a problem that nobody else really wants to solve and have decided to make a difference in their communities.
Thank you.
I think Dr. Romo and Pastor Goodman said it all. We've definitely expanded since 2019-2020 when this documentary was filmed. When I started, like everyone mentioned, we're about a staff of probably 10, and we're almost at 40. So that just speaks to the testament of the work that we continue to do. It's not that we've seen this tremendous increase in gun violence, it's that we've seen expansion in our social work, being able to offer more social work support, mental health support, wraparound services to our patients and also to our participants. So we're very grateful for that.
Great. Does anyone have a question? Does anyone want to raise their hand? Okay, well, let's start with one question that someone relayed. What was it, and I know this went into a little bit with Dr. Teperman in the film, but what was it that inspired all of you to get involved in this work, either through creative storytelling, in the case of Jenniphyr and Jody, or for anyone else here? What was it that inspired you to get involved to try to make a change here? If anyone wants to start, we'll just go down the row here.
So I guess he's asking, maybe a better way to ask, a different way to ask this, is how does this film get started?
It was Jennipher's idea. She read an article called What Bullets Do to Bodies by Jason Pagon, and we went out to dinner one night and started talking about it, and thought it might be interesting to make a film from a public health perspective on what the effects of gun violence and how it affects public health communities. And then as we did more research and delved into it, we found these terrific hospital-based programs that okay. Anyway, we're both shy. Yeah.
So I was looking at this today. So I'm going to ask you a little bit. So YouTube.
Yes.
There are 3.5 million hits for this film. So this film is. I'm going to look at the audience. It's difficult to sit through, right? I remember the first time I sat through it, and I'm like, I'm not having fun. Right? America has got a real problem here. But the thing that really impressed me is the level of detail that you went into about people's lives and how they're disrupted by gun violence, right? So it's the statistic, by the way, it's 47,000 gun deaths in America, by the way, 2/3 of which are suicide. So the problem is going backwards, it's not improving. I mean, no disrespect to my SUV colleagues, you're doing a great job, but America really does have a sickness. So,
and there's one other statistic that we keep hearing, and that is firearms are the #1 killer of children ages 1 to 17 in America, which is not a statistic shared by any other nation in the world. So.
And just another ironic, so Mr. Mastromanno is here, he knows we train the U.S. Navy SEALs. We've also had the special operators from other parts of the world come to Jacobi. So the special operators, special warfare commandos from Britain come to Jacobi. Why? Because they don't have gun violence in Europe or in the UK, so they have to come all the way across the Atlantic to the Bronx to learn about urban warfare. I mean, how horrible is that? It's just, I mean, let that sit there for a second. But where else has the film premiered?
Well, it did very well internationally, surprisingly, right? I mean, it's been in Europe, it's in Asia, it's in Australia, and it went through film festivals, and now it's on Amazon.
Let me just add, one of the things that got me interested into SUV when I was approached to be a part of SUV and to be a part of this program tonight that you have seen is doing eulogies for our young people. It's a passion because in 31 years I've done over 4,000 eulogies. Jesus. At least 10% of those eulogies have been young people that have died to gun violence. Just recently, matter of fact, about a couple of months ago, I eulogized a young man that was shot right here on Brunswick Avenue, a 22-year-old. And I was talking with his mother. She was talking about how the SUV program, I called Carjah from the funeral home. And so, oh, okay, we're working with this family. But we don't recognize until death hits home, the pain. And somebody said this in the documentary tonight. You know, it's not until it hits your homes. Many of us overlook it until it hits our home. But believe it or not, somebody we know, as they said in this documentary tonight, somebody we know or somebody we're living with or somebody that's part of our family have been a victim of gun violence or perpetrator. So it has basically moved me to passion for our community. And one of the things that we said in the documentary is that what makes us common is having that unity. And when we can be common with our unity, that's what builds greater communities. And so I'm glad to be a part of this. I'm glad to be a part of it.
Yeah, no, I think for me, you know, I trained here at Jacobi as a pediatric resident. I was here as a student as well. So pretty much all throughout my training, kind of along with Dr. Teperman's team, the ER team, just seeing firsthand the impact of gun violence and trying to figure out a way to, you know, go beyond the hospital, right? And realizing that the hospital, we can't do everything in the hospital. We can heal wounds, we can do our best to get people back on their feet, but once they're out there walking on their own, what can we do to really help them heal? What can we do to really try to address the underlying issues that really lead to violent trauma victimization? And I think even before that, you know, I grew up in a neighborhood where there was a lot of violent trauma as well, where I grew up, so I did lose some family and friends to violent trauma myself. So coming here and being on this side and of treating patients really kind of influenced me to be on the other side of it and try to prevent more families from feeling some of the pain that my family felt and that people in my community felt. So although I grew up way on the other side of the country in LA, the Bronx is my home now, and it's been my home now for over 22 years. So the similarities are very similar, and I think that it keeps me connected to the community, it keeps me connected to the work, because, you know, we're not just here to help heal individual wounds, we're here to help patients make their lives better and make communities better. And I think communities need to heal themselves, and communities have the power to heal themselves. And I think in the hospital, we have the ability to help communities heal.
Hi, thank you for all hosting us here and kind of letting us partake in this with you. I've got two questions, but I don't want to be greedy, so I'll start with one for the SUV team. I was wondering if you guys have been able to export this program at all to other hospitals around the country or other communities? I think that's my first question. I'm pretty curious to see. It's a wonderful program.
Yeah, so our primary funder is New York State Department of Criminal Justice Services through the SNUG program. The first hospital-based program they funded was here at Jacobi back in 2014, and since then, the model that has been established here is now being expanded statewide. So the model is being applied to other hospitals. There's now a dedicated social work supervisor, dedicated program director for the state, and dedicated medical director. And myself, I was brought on to lead that effort, and we are now in 4 other hospitals throughout New York State with similar programming. Not the exact same model, as the model changes from community to community, depending on resources and local needs, but the same interdisciplinary approach of having community component, social work component, and a physician public health component is being applied statewide, and we've been able to establish the first of its kind statewide network of hospital violence intervention programs throughout the state. Just this past Wednesday, we had our first statewide hospital violence intervention program conference, which is the first one that's ever been held in any state. So everything that has happened here in this city hospital in the Bronx is now being applied to other hospitals throughout New York State.
Thank you. I guess I will be a little greedy, so thank you again for hosting this. And this one's more for Jody and Jenniphyr. I was wondering why you decided to tell the story through the viewpoint of trauma surgeons.
Well, because it really hadn't been done before when we started doing research, and you hear a lot about the mass shootings, but not the everyday gun violence that comes through Jacobi and Temple and Johns Hopkins and many other hospitals. And as we did more research into it, we were really impressed with the hospital-based violence intervention programs. And I hope, it's a heavy subject, but I hope it's inspiring in some way to see the work of these incredible healthcare providers and the SUV team, because we feel it was an honor to watch them work and tell their story.
I'm the worst public speaker, but I just want to say that this is SUV and Jacobi, that you guys are the real Marvel of the universe and
Yes.
real superheroes every day, and I really appreciate what you do every day, because it's quite a lot, and yeah, it's just immense, and I have too many words and not enough words, but I just want to thank you for inviting us here. It's really an honor and a privilege.
I was going to say, a lot of the violence is invisible. You don't read about it in the papers every day, but these folks are doing their jobs day in and day out, and it's saving lives. Both the physicians and the nurses and the healthcare providers, as well as the SUV team.
I'm not sure who the right person is to answer this question, but so you've got this incredible, fabulous documentary. One of the things that sort of went through my mind as I watched it is the part of what you've been doing, stand up a gunshot violence, is trying to get people in the community to understand and act on that. The documentary is one way to do that. Has there been thought in terms of going into schools, the high schools, here and other parts of the country? I would love to see some of this being shown in congressional environment, state and local environment. And so I just wonder what some of the thought process is that you've had around this. That's it.
So in terms of the work that we've done since the documentary aired, we've been able to expand to our services that we've been able to provide in the schools. So we do have a school hospital liaison who's able to go into the schools, speak to middle school students. Daniel's here, is he still here? Oh, yeah, but he was here earlier. He was here back then, so he's somebody that's been in the program for a very long time. We've also started some support in Stevenson High School, where we have a dedicated staff that's in that high school providing conflict mediation, doing safe passage. Also having an outreach worker, Joe is here as well. He's in the schools with Aaron, who's our school coordinator, to support that school community in terms of being able to prevent any sort of gun violence and any sort of violence in general. So that's something that we've been able to do. We've also hosted some students here. Not too long ago, we had some students from Fordham Leadership Academy come in, and they watched the documentary with us, and they also got to see our program, hear about what we do every day. We foster a really good partnership, and they did get to view the trauma bay as well. So we've done some work. There could be more, especially when it comes to the schoolwork. We really would want to be able to help the students and the kids, because we don't want them to be disconnected from school, because someone being disconnected from school means that they're closer to the streets and closer to being the highest risk.
And I'll just speak to the community response. As a director of community outreach for Jacobi Stand Up to Violence, one of the things is we want to make sure that our community is not afraid to walk outside their doors. One of the stories you heard about the 92 that Dr. Teperman shared in the documentary is about the 92-year-old woman that was shot right here, I think like 219th Street somewhere near White Plains Road. And the success of this program has been, and Kwame Thompson can attest to this, when we started in Bronx River houses, how the seniors were afraid to come outside. But about a year later, once the program had been instituted in Bronx River houses, the seniors were back outside, the community was coming back together. And I think that's the thing as we gather up, and my role as the director is to get the elected officials, get the community and the clergy. So when you see the marches that we had, we want our community to know no longer do we stand by, but we stand up to the senseless gun violence that's plaguing our street. And the fact of the matter is that I just recently met, even with our commissioner, and talking just about in Bronx County alone, we still see that even though the facts are showing that gun violence is coming down, but yet one shot fired is still one shot too many. One parent that I have to yet continue to talk to and yet eulogize their child is just one child too many. So I'm praying that gun violence can be eradicated, that I don't have to sit with parents anymore and talk to them and try to comfort them and console them at the loss of their child.
Can you hear me? Oh, yes, I can hear you. So, I got a two-part question. One part is because one of my church members decided to act shy right now, so I'm gonna ask that question first. Is anybody aware of Cradle to, what is it again? Cradle to Grave program initiative, and is it still in existence?
So it's Temple,
I
right?
don't think it is, but I'm not positive about that. Amy Goldberg has moved on. She's the dean of a medical school, so I'm not sure.
So there is some scholarly work that suggests that, so this was not a scared straight program, but it did come close to it. So the kind of work that SUV is doing is from an academic point of view, is better recognized. So Cradle to Grave comes very close. So that scene, did you guys see the dead babies only here shot? Which, when I first saw that.
I thought that was too much.
So, yeah, actually my partner thought that was too much. But, so there's a question about whether or not exposing young people to that kind of horror drama creates more trauma. Yeah. So, I think that Pastor Gooding and the rest of the SUV team have a better pathway with dealing with communities and young people. We've started to move away from things like Cradle to Grave, and definitely pictures of dead babies in a cooler. Yeah.
Thank you. And the other one is, in the documentary, there was a brother, and the human service mantra is meeting people where they're at. And the brother was in the hospital room talking to the guy, And, basically saying it's good to talk to him while he's here right now because you guys undivided attention pretty much. So I want to know whether, and this is obviously evidence-based and working, and I commend everybody, right? But what is the possibility of this model being taken into the prison system? Why I ask is because a lot of people that's in the prison systems are mentally incarcerated, not just physically. And if somebody can meet them where they're at, they can come back into society being productive members of society, and the seeds could be planted for that structural behavior change while they're in there.
Yeah, I mean that's a tough question in terms of applying a model like this to the prison system, which is a whole other slew of issues and problems involved in that system, as you well know. And there are similar models in terms of providing mentorship to individuals when they come out of the prison system. I do agree that the prison system itself is broken, right, and that prison is not used as a form of rehabilitation, right? Individuals in there don't have the resources that they need. I know we often get this question, right, Carjah, about how our program can get applied to settings like that. It is different, every setting has a different set of needs, a different set of resources. And I think what we realize here, at least at SUV, I think Dr. Teperman knows the politics of it very well in terms of dealing with the gun politics, is that I think we decided here is to what can we do locally, right? What can we do that can work? How can we help individuals? What can we control, right? Is the patients that we serve, how can we treat them in the hospital, and how can we meet them where they're at when they leave the hospital within our community to improve their outcomes? Because that's what we can control. We can't control a lot of the external factors, right? And we're lucky enough here, Mr. Maschermano is here, right? Our CEO, who's been very, very supportive from day one, right? Since he's been here. And I want to commend him for that, because that's not something that you get from every single CEO or leader of a hospital or of an organization, to believe in a model that's, quite frankly, outside of the box, right? To have that vision, to say, I believe in you, I believe in your program, and every time I see him, it's always, what do you need? How are you doing? How's the program, right? That's always his question. We had our peace walk last week. He was out there with his leadership team, walking and marching with us in the community, right?
And speaking.
And speaking. That's not something you see all the time. So I think change happens sequentially, and when you have people at every level that are invested.
And let me just add this also. One of the things, when I was first asked to join this program at its inception, was my personal feeling as a pastor, as a father, as a grandfather, is that if we can reach our children when they're in elementary school, I believe that sometimes even junior high school and high school, sometimes it's a little bit too late. But if we can plant that seed in them, that's why I'm glad to have our youth that's here tonight. Give them a hand clap, because I'm glad to have our young people sitting here tonight. If we can reach them and plant that seed, go into the elementary, matter of fact, we have done that. We did a presentation while we was at 121, which was my former alma mater, elementary school. While we was actually there was when a 16-year-old young man got shot in the 47th precinct on his way to school. So I'm a firm believer that if we can catch them beforehand, and if we can plant that seed when they're babies, when they're young, those second and third graders, I believe by the time they get to junior high school, this is just my feeling. I know doctors might not feel the same way that I feel, but as a pastor, I see it every day. And if we can plant that seed in them early in elementary school, I believe that it'll save them from having to go to the prisons.
And it does look a little different with the second and third grade. Because we do have, we do go into the school and talk about our program. It looks like we ask them about safety, we talk about bullying, because we know that those are the things that can build up to, people getting involved in high-risk behavior. So those are the things that we kind of tailor to the younger population so that they understand.
Hi, first I have a comment to the filmmakers. I was born on Kruger Avenue, not too far from here, and I remember, didn't live it that long, but I remember looking at that train, the elevator train, and it seemed to me as a very little girl that Manhattan was really, really far away. It was another country. And so and what tends to happen is communities get atomized and they get reduced. And it's easy to think about populations that are decimated by gun violence as being very one-dimensional. And what you all did in an hour is you presented us with a portrait of people, of whole people who were then ripped apart, whole people who were with holes in them. And the complexity of those people, and the complexity of these communities, and the breadth of them, and the love, and the support, and the brokenness is all in this. And that's a remarkable achievement, especially for a film that could so easily lean into exploitation and reduction. That's my comment. But my question is, and this has lots of Dr. Teperman sort of remarked on something which has generated this question. Making a film like this requires very, very almost surgical precision in respect to editorial decision making. I'm talking about what do you include and what do you exclude, not just in terms of the shots you choose, but the people you feature and the communities you select. There's a saturation point, and I literally mean that. I mean, the blood saturates people's garments, and sometimes the blood is everywhere, and I think at some point you just dissociate, like the person in that ambulance has said. I think it was the doctor who said when I got shot in the neck, I was looking at myself from above. That's dissociation, says the psychoanalyst, which is what I am. That's what happens, and so you have to find that tension, that place where people are engaged and they're moved, but they're not so overwhelmed that they dissociate, or they're not so outraged and disgusted that they can't look. And I'm curious about that editorial process. I mean, you included that shot of that horrifying baby enclosure. I'm sure that was a decision you had to think hard about, and I'm curious how you went about making those choices.
Those are good questions.
Yes. Yeah, that was a good question. Thank you. Thank you for your kind words. It took a long time. This film took about 3 years to make. And actually, the scene that you referred to, we had to make different versions for different outlets. And that didn't make the cut, the scene in the morgue, for some of our outlets, because it's hard. It's hard to look at. You know, the editorial process, it took a long time working in the edit room together, Jenniphyr and I, with our editor, and we wanted to make a film that was watchable, but that had an impact. So I appreciate what you said, because it's a tightrope sometimes that you're walking, where you don't want people to just be so make it so hard to watch that they're just going to turn it off.
I just want to say that as a pediatric hospitalist myself, and somebody who treats patients, children, and recognizing that, you know, firearm injury is the leading cause of death in children, as hard as that scene was to watch, for those of us that live it, I think it did bring an element of a reality that exists, and without showing you the body, you know, of a child that's decimated, it showed you the reality that this is where these children can go. For those of us that have seen children, our youngest age is 3 years old that we've seen the patients here. One that passed away, one that did not. So, you know, it is a reality, and it's a reality that we do have to face. So I actually applaud them for having the courage to include that, as tough as it is to watch, because it is indeed the leading cause of death of children in this country, and we need to accept that as a country, that our children are dying from a very, very preventable cause. And that's a reality that we all need to see.
Hi guys.
Hey.
So I'm listening to you guys ask the questions to leadership, and I just want to make a comment about the babies' pictures. We talked about this documentary, but who's the audience of this documentary? Who do we want this documentary to reach? I am from the community. I got stitches in this hospital. My husband passed away in this hospital. You know, Dr. Teperman was a surgeon. My kids grew up without a father. When I say that was perfect and that is what the community needs to see and some people need to see, it's raw, it's uncut, it's the reality. It may be insensitive to somebody who doesn't live in the community, like Dr. Romo said. But this is what the youth need to see, and the people that we're trying to change need to see, because we don't want them to see it when it's already too late and it's the reality, right? So if it's insensitive, or maybe it's causing a little bit of trauma, but it's the reality, and it may not be everybody's reality in here, but it's our reality, and these are our communities that we're working in, and these are the kind of things they need to see in order for them to know that this is a real thing. It's real. This is a real thing, like the documentary said, them 14 minutes, once the morgue, this is the last stop, there's no more stops after this. These are the type of things that our youth need to see, to understand that moment of just the instant gratification of getting somebody back or doing something to somebody, you might not come home. You talk about parents who are raising their children and putting every effort into raising these children as best as they can with the resources they have. So one day have to just bury their kid, they just don't have a kid no more. I don't know. I know somebody who is only had one child. She had to bury her one child. It's the same night that my husband was shot. I watched Dr. Teperman tell the family that he was not going to be here no more. His name was Jared, 12 years ago. I can never forget it because I was here. So these are the things that we need to see, because this is the reality. It may not be everyone's reality, but it's the most important people's who we are trying to change is reality. So I don't think it's insensitive, and I think that maybe you guys need to hear that to understand why it was necessary. And I think it was a phenomenal documentary, and I think it was perfect, and I can't do nothing but say thank you to every person who included in the program, that supports the program, that sponsors the program, that takes their time to care about the program, from the directors to everybody in leadership. Everybody treats each other like we're equal here, everybody cares, and this is what we need. We need more of this, we need more exposure of this, and if we can do that, we'll be great again. That will be great again.
If I may for a second, I just had a deja vu moment. So Dr. Romo knows this, that here at Jacobi, but all over the cities, I serve as the chief trauma surgeon for New York City Health Hospitals. I've initiated a new policy. When a patient dies of gun violence, we have a moment of silence in the trauma bay. And we reflect on the fact that, just like it was said in the movie, this is someone's child, this is someone's mother. There's a tendency for healthcare professionals to become inured, to become sort of blank to violence and desensitized. So and this is deja vu moment happens to me as I'm watching the movie. So when I have this moment of silence, I hold it in the trauma bay until everybody's uncomfortable, right? And then, people are like, when is Dr. Teperman gonna let us talk again? Till everybody's uncomfortable. And then you can talk again, because you need to be uncomfortable. The other thing, to the deja vu moment, I was sitting next to Jody, is I'm uncomfortable a lot watching this movie. And one of the things that I talked to Jenniphyr and Jody about is you should tell the story about the paralyzed patient, because that is a very much undertold story in America. The spinal cord in your body is only about as big as my pinky, but yet you saw 1 in 7 gunshot wounds affect the spinal cord. Bullets tend to find the spinal cord. And they did a beautiful job of, that they follow the photographer around. But it is, watching him, very hard to do, right? Just focusing on him and his life and that wonderful group and that support group. And you held it there, right? You really held us there. This is their lives, right? This is what the bullet does. This is not something America wants to think about, right? So a long moment of pause in the trauma bay, and let's think about these victims.
That's good. Let me just add to that too. Let me just add to that right quick, because one of the things I think also is our communities has become desensitized also to the violence that's plaguing our streets. And one of the things, and again, I'm so grateful that when we can see the community taking an active role, coming out to our rallies, now being able to go outside their doors and not be afraid, that's a great achievement from our outreach workers and SUV team. So communities are being, again, desensitized, but I think it's important that we make them feel that. And one of the things that I used to tell our outreach workers is that every time someone gets shot, we ought to feel that also. We ought to feel that also. And I know, you know, as a pastor, as a minister, when I'm doing these eulogies and speaking to parents, somebody asked me, Pastor, how you've been doing this for so long, how can you do this? But it's also, I have that sympathy and empathy for how parents are going through this. I too lost my daughter. It wasn't through gun violence, but I had the toughest day of my life was to eulogize and bury my own 41-year-old daughter. But it lets us know that I believe that as a community, we cannot become desensitized to these shootings and the violence that's plaguing our communities.
My name is Jacobi and SUV worker, and what we like to do is ask each other what level we on. I'm on a level 10 right now, and I want to let y'all know why, because I've seen this story, and I want to let y'all know it's not a documentary, it's my life. The part that was brought up, that's one of my communities in there, Bronx River, and unfortunately I lost my brother to that, my brother Dawn. But it was more of me getting this job, because at one point I was on both sides of the trigger. I'm not gonna lie to you, I was on both sides, behind it and in front of it. And me losing my brother and getting the call from my brother Eddie right there, before I even knew him, this before me working here, I was a participant here at one point. A participant before working here. I got my life together, I made sure I did everything right, I got my 2 kids here to make sure they watch the story. But I was a participant. Through the guidance of this program, I'm talking about from seeing people get shot and seeing, because when you're in the community, I'm gonna tell you the real, you think this program is doing nothing. You think, oh, they're not doing nothing, they're not, but when you see the formats they take to help you guys, to help us, to make sure our communities better, and we just don't only deal with gun violence, don't let that, we deal with gun violence, that's our main focus, but we're dealing with the whole community. Mental health, we're dealing with people, hot water being off, electricity, everything. We are the pillars of our community. We are our community. These people that you see with these green, orange shirts or whatever, we're in our communities every day. We grew up in our communities. So we see these elderly people pass away, like the 92-year-old. We don't just see that as that's somebody's grandmother here. Like, they may not be here, but somebody grew up with their grandchild. Like, they know them. Like, these things hit us hard. So we come here, when you see us, we the people that was at one point the reason of the gun violence, and now we're trying to help the gun violence. Like, we know this is a disease, and we're trying to get rid of this. This disease is terrible. Between this and mental health, and they run hand in hand, it's like we're trying our hardest, but we also need help. It's not like we can all get this done, because we know the community, now we need the help from everybody else to come in the community and help us. With the funding and all that, we don't care about money, we just want the money to help bigger things. Our kids are seeing things that they're not supposed to. We're being uplifted to guns, drill music, all this stuff that has nothing to do with nothing. And our kids are not even finishing high school grade. They talk about taking about border education from us. So that's all I have to say. We're here fighting for y'all.
Thank you. A comment and a question. I'm going to stay on the topic of children. Thank you for making this. This film has the ability to move the needle and shift opinion. The comment, and I'm here with my family, we're practicing Christians and Catholics, and the position that so many elected officials leverage to take office is life, being pro-life. But it seems to end as soon as the baby is born. So when some of these poor children are riddled with bullets or cut in half in these school shootings, all they can do is say, I have to wait for all the facts to come in, or my thoughts and prayers, which to me is a cop-out. So my question now is, do you truly think that people on the dais, especially the doctors, that there is still a path with legislation to move the needle and make change for improvement? Or
because this was enlightening to me on the work that the folks in the SUV are doing God's work and the numbers show it. Is it better that if we can't make any progress, which we haven't been able to do on legislation because of politics, is there a better path to invest money in programs like this, which actually is making a difference in reducing gun violence? Thank you.
So I'll start with the first part of that question, which I, by the way, totally appreciate the whole what about life right after you're born thing. So this is actually intellectually not a complicated problem. So we don't have it in Britain. They had a little bit of a problem in Australia. They made a law, no gunshots in Australia. So from a legislative point of view, so 40%, so I spent the better part of 2 decades on the board of New Yorkers Against Gun Violence, talking, I spent some time in Washington and New York State, New York City legislatures. So 40% of gun transfers in the United States of America, when a gun goes from one person to another, do not undergo a background check. And there is something called the Iron Corridor, which is 95, which comes up from the south from states like Florida and Alabama. And so the guns in our cities don't come from New York City. They come from places that don't do background checks. And there are a small but discrete number of firearm dealers that routinely have straw purchases, and the guns come from centralized locations into our cities all over America. This is not a hard problem intellectually to solve, right? Every gun transfer has to go a background check. Everybody that has a gun has to have a license and registration and a safety course. There are lots of other things you can do to protect your kids from gun violence, like child safety laws and red laws. That poor woman that was struck down by her husband, right? That man never should have had a gun. So there are, the Brady or various other anti-gun violence organizations will, for states that have these laws, do much better in terms of protecting their citizenry. But the nation itself is a sieve, right? Because no matter how well New York protects its borders, so for example, New York has a gun show safety loophole, right? So all gun transfers in New York actually undergo a background check. But if that's not happening in Alabama or Florida and the guns come up from there, it's kind of useless. So we could, tomorrow morning, have no gun violence in America if we as a country had the will to do that. And the Second Amendment has been reinterpreted. It was interpreted one way as a collective right for 100 years, and it was reinterpreted about 9 years ago by the Supreme Court. We could reinterpret it. So that's the first part of your question. So, and I do have to say that we could make 10,000 no-way Romies, although there only is one, and there's definitely only one Pastor Gooding, and we would probably still have 46,000 gun deaths. 2/3 are suicide, right? So as a trauma surgeon, you take some pills, you have a 50% chance of killing yourself. You hang yourself, you have an X% chance of killing yourself. You take a gun and you put it in your mouth and you pull the trigger, 95% of the time it's going to work. It's a very impulsive thing. It's young people, if there's a gun in the home, it's very dangerous. Elderly people who are by themselves and depressed at a moment. So most of these gun deaths, by the way, do not happen in New York City because there aren't a lot of legal guns. So, America has to have a conversation with itself, and no, I'm going to let Noah answer this, but no, we're never going to get out of this sickness, this what I call a folie à deux, until we actually have this conversation with ourselves and we actually pass laws like they have in Europe and Australia, and we do something reasonable with the guns themselves. That's what I think.
I think in terms of that, like Dr. Teperman said, in short, we're not too optimistic about legislation coming about to help. And I think choice we've made here is if we can't change the number of guns that are circulating, perhaps we could change behavior. Perhaps we could convince somebody to not pick up the gun. That's it right there. Regardless of the number of guns that are available, we can convince enough people to not pick up the gun, to find alternative means of mediating the conflict, giving them healthy alternatives of dealing with whatever they're going through, giving them alternatives for employment to improve their lives so they're not resorting to that. That's what we can do. And I think, do I think these programs can work? I mean, yeah, we've proven that they have. Is it 100% the solution? No. But I think it's what we can control and it's what we can do. Because ultimately, I don't think the politicians are gonna come and save us, right? I think we're gonna have to make decisions for ourselves.
Thank you, everybody. Let's give the panel a round of applause. This was only supposed to go on for 30 minutes, but we went on for 60. So I thank everybody for coming out here tonight. Have a good night. Get home safe.
So we're having dinner, right?
Yeah.